If you're over 70, you've probably heard this message countless times. Get your checkups regularly to stay healthy. But what if some of those checkups, the ones you've trusted for decades, might actually harm you more than help? Every year, millions of seniors in the U.S. line up for medical tests they believe are protecting them. But new research from leading health institutions like the Mayo Clinic and Harvard Medical School reveals a surprising truth. Not every test is beneficial after a certain age. In fact, some may lead to unnecessary stress, risky treatments, or even long-term complications. Let's be honest. Most older adults go through these tests out of good intentions. You just want to stay safe, catch problems early, and live longer. But medicine isn't one size fits all. After 70, your body, your metabolism, and your immune system function differently than they did when you were 40 or 50. That means some routine screenings can do more harm than good, especially when your results are misinterpreted or followed by aggressive treatments. Recent studies estimate that up to 35% of medical tests performed on seniors lead to unnecessary follow-ups, false alarms, or side effects. The reality, overtesting can quietly push you toward procedures that don't improve your health and sometimes reduce your quality of life. In this video, we'll reveal 5 common health checkups you should think twice about after age 70. Each one sounds harmless, and some are even advertised as life-saving. But behind the friendly clinic posters and well-meaning reminders lies a growing body of evidence suggesting that, past a certain point, less can actually mean more years of healthy living. We'll walk through each of these tests, one by one. 1. The innocent bone scan that may do more damage than good. 2. The brain scan that can trigger anxiety and unnecessary surgery. 3. The heart test that too often sends healthy seniors into the hospital. 4. The colon screening that becomes risky after your mid-70s. 5. And finally, the full-body scan that could quietly raise your cancer risk, all backed by real stories, credible science, and lifestyle-based alternatives that actually work. Because here's the thing, staying healthy in your 70s and beyond isn't about chasing every medical test. It's about choosing wisely, knowing when to screen, and when to simply live well. By the end of this video, you'll understand which medical tests might be unnecessary or even harmful for older adults, what the latest research says about safer alternatives, and how to build real protection through lifestyle habits, from nutrition to movement and mindset. Before we dive in, I want to hear from you. Have you ever gone through a medical test that left you feeling worse physically or emotionally? Did you ever wonder if it was really needed? Share your experience in the comments below. Our team reads every comment and replies with practical, research-based advice tailored to seniors like you. And if you value trustworthy, science-backed health insights for life after 60, don't forget to like this video and subscribe. We post weekly tips based on the latest medical findings simplified for real people, not textbooks. Now, let's begin with number 5. A test that sounds simple, painless, and smart, but for many older adults, ends up being the first step toward unnecessary medication and years of side effects. The bone density scan. Let's start with one of the most common tests ordered for adults over 65, the bone density scan, also known as a DEXA scan. It sounds simple, no needles, no pain, just a quick scan to measure how strong your bones are. The idea is that it helps detect osteoporosis, a condition that makes bones fragile. But after age 70, the picture becomes more complicated. Here's what most people aren't told. Bone density naturally declines with age. It's as normal as getting wrinkles or gray hair. Yet, the way DEXA scans interpret these results can make normal aging look like disease. Many older adults get labeled with osteopenia, a mild bone thinning that doesn't usually lead to fractures. And suddenly, they're prescribed strong medications. These drugs, called bisphosphonates, are meant to strengthen bones, but studies from the American Geriatric Society and Johns Hopkins University show that in people over 70, these medications often have minimal benefits and significant side effects. One 2022 study found that taking bisphosphonates for mild bone loss in women over 70 reduced fracture risk by just 0.3%, but increased the risk of digestive irritation, jaw pain, and even brittle fractures in other parts of the body. Let me tell you about Rose, a 76-year-old retired piano teacher. She had never broken a bone, stayed active, and walked every morning. After a routine DEXA scan, she was told she had osteopenia. Her doctor prescribed a bisphosphonate medication. Within 3 months, Rose developed painful acid reflux and stiffness in her jaw. It turned out the drug was doing more harm than good. When she switched to a more natural approach, vitamin D, calcium-rich foods like sardines and leafy greens, and light-resistance exercises, her strength improved dramatically. A year later, she was back to performing, walking taller, and feeling stronger. That's the real power of lifestyle medicine. The Cleveland Clinic reports that regular weight-bearing exercise, like walking, gentle squats, or resistance bands, can increase bone density naturally, even in people over 70. Combine that with 801,000 IU of vitamin D per day and calcium from food sources, and you can reduce fracture risk by up to 20%. Here's the takeaway. If you haven't had any fractures, and you're physically active with no symptoms, a DEXA scan may not tell you anything new. Instead of focusing on the number on a screen, focus on movement, balance, and nutrition, the 3 real pillars of bone health. Now, if your doctor insists on a scan, it's okay to ask questions. What will we do differently if the result shows mild bone loss? Are there lifestyle alternatives before trying medication? Can we check vitamin D and calcium levels first? The best doctors appreciate patients who ask. Medicine is a partnership, not a one-way conversation. Because here's the truth. Health isn't just about what we measure. It's about how we move, nourish, and live every single day. Now that we've looked at the bones, let's move up to the brain. It's one of the most feared areas of aging. When you forget names or misplace your glasses, it's easy to panic. Is this dementia? So many seniors rush into one particular scan, hoping for answers, the brain MRI. But what they often find is not clarity, it's confusion. Let's talk about why this test, while valuable in some cases, can sometimes create more fear than it solves. When seniors begin to feel forgetful, the first thought that comes up is Alzheimer's. It's a terrifying idea, losing control of your memories and independence. Naturally, many doctors respond by ordering a brain MRI, a detailed imaging test that looks for structural changes in the brain. But here's the surprising truth. Most MRIs done for mild forgetfulness in people over 70 don't show anything dangerous. Instead, they reveal things like white matter changes or slight shrinkage, both perfectly normal with aging. According to a 2021 Neurology Today review of over 3,000 seniors, 86% of MRI scans in patients aged 70-85 showed some kind of abnormality. Yet only 3% of those findings were linked to an actual treatable condition. That means 97% of those people went home with more worry than answers. Worse, about 12% were sent for invasive procedures like spinal taps or even biopsies, all based on normal, age-related changes. Meet George, a 74-year-old retired engineer. He went for an MRI after feeling more forgetful with names. The scan showed a few white spots, and he panicked. He withdrew from social life, convinced he had early dementia. But when tested with a simple cognitive screening, a short paper-based test, his memory was well within the normal range. Once he stopped worrying, his mental clarity returned. That's why many neurologists now recommend starting with a cognitive test. Not a scan. It's inexpensive, takes 10 minutes, and can identify early signs of real cognitive decline without the stress of imaging results that may not mean anything. If the test shows a problem, then an MRI may be appropriate. But for mild forgetfulness, lifestyle changes often make the biggest difference. Prioritize 7 to 8 hours of sleep. Memory consolidation happens during deep rest. Stay hydrated. Mild dehydration can mimic memory loss. Engage your brain with puzzles, reading, or learning something new. Stay socially connected. Isolation speeds up memory decline more than almost anything else. According to the National Institute on Aging, these daily habits improve cognitive function far more than unnecessary medical testing. So next time you or a loved one feels forgetful, don't rush into a scan. First, breathe, ask questions, get a simple cognitive test. And remember, your brain is like a muscle. It strengthens when used with purpose, not fear. Now, let's move to the next test, one that's done in almost every clinic, but can often lead to risky, unnecessary heart procedures. It's called the cardiac stress test. And if you're over 70, it might not be the friend you think it is. Let's talk about the cardiac stress test, a test that sounds reassuring, but can quietly lead seniors into a cycle of anxiety, false alarms, and even risky procedures. A stress test measures how your heart performs under pressure, usually while walking on a treadmill. or after taking a medicine that simulates exercise. It's meant to detect blocked arteries or signs of heart disease. But here's the catch. After age 70, this test can be misleading. The reason lies in how our bodies change with age. As we grow older, our arteries stiffen slightly, and the heart rate doesn't respond as quickly to exertion. These natural changes can create false positives, meaning the test says something's wrong when it's not. Research from JAMA Cardiology found that in adults over 70, the false positive rate for stress tests can reach up to 40%. That's almost half. And what happens next? Those positive results often trigger more invasive tests, like angiograms, or even stent placements, procedures that may not improve lifespan or quality of life in older adults without serious symptoms. Take Raymond, a 75-year-old retired postman. He stayed active, walked daily, and just felt a bit tired on hills. His doctor suggested a stress test just to be safe. The results were unclear, so he was sent for a cardiac catheterization. A small narrowing was found, and a stent was placed. But that night, he suffered a kidney reaction to the contrast dye and spent 6 days in the hospital. Months later, his fatigue was exactly the same because it wasn't a heart problem at all. It was dehydration and lack of rest. That story is more common than you think. Studies from Harvard Medical School and the Cleveland Clinic confirm that unless you have clear symptoms like chest pain during exertion, sudden shortness of breath, or fainting, a stress test might not be helpful. In many cases, it leads to procedures that don't extend life, but do increase risks of bleeding, infection, or kidney injury. So what can you do instead? Ask for a resting EKG first. It's simple, safe, and often provides enough information. If you want more insight, consider a coronary calcium scan, a low radiation test that measures plaque buildup without the risks of invasive procedures. Focus on prevention. Maintain a balanced diet rich in omega-3s. Stay hydrated, walk daily, and manage stress, all proven to keep your heart strong. As the Mayo Clinic reminds us, the heart thrives on consistency, not extreme tests, but steady habits. Walking, gentle stretching, breathing exercises, and maintaining social connections can all protect your cardiovascular system far better than an unnecessary stress test. Now let's turn to a test that almost everyone over 50 knows well, the colonoscopy. For decades, it's been considered the gold standard for preventing colon cancer. And yes, for many middle-aged adults, it's life-saving. But after age 70, the balance of benefits and risks starts to shift. A 2019 JAMA internal medicine study of more than 1.3 million Medicare patients revealed that for adults over 75, colonoscopies saved about 2 lives per 1,000 procedures, but caused serious complications in more than 20 people per 1,000. That's a 10-to-1 ratio of risk to benefit. The problem lies in the preparation and the sedation. The strong laxatives required for colonoscopy can lead to dehydration and dizziness, increasing fall risk. The anesthesia itself may cause confusion or temporary memory loss, and the scope can occasionally tear the colon wall, a rare but dangerous complication. Let's look at Dana, a 73-year-old grandmother who ran a bakery with her daughter. She had no symptoms, no bleeding, and 2 prior clean colonoscopies. Her new doctor encouraged her to get another, just to be sure. During the test, a tiny polyp was removed. That night, she suffered severe pain and a bowel perforation that required emergency surgery. She lost 10 pounds and spent weeks recovering, all for a screening she didn't need. That's why most medical guidelines, including from the U.S. Preventive Services Task Force, now recommend stopping routine colonoscopies after 75, unless you have specific symptoms or a strong family history of colon cancer. For those in good health who still want screening, consider the FIT test, a stool-based test you can do at home. It's non-invasive, doesn't require fasting or sedation, and catches most concerning signs early. Remember, testing is not the same as prevention. Prevention happens every day through fiber-rich foods, hydration, and regular movement. The Mediterranean diet, rich in whole grains, fruits, vegetables, and olive oil, has been shown to lower colon cancer risk naturally. Finally, let's address the most controversial test of all, the full-body CT scan. It's often marketed as a complete health check for people who want peace of mind, but the truth These scans can do far more harm than good. A single full-body CT scan exposes you to as much radiation as 500 chest X-rays, and there's no proof they improve longevity in healthy adults. In fact, according to Harvard Health Publishing, unnecessary CT scans may now account for up to 5% of all new cancers in the U.S., roughly the same risk as drinking alcohol daily. Here's the real problem. CT scans detect tiny, harmless things like cysts or calcium spots that don't need treatment. But once they're seen, the system kicks in follow-up scans, biopsies, and sometimes even surgeries. One small finding can snowball into months of fear and invasive procedures. Take Marcus, an energetic 80-year-old martial arts instructor. He felt fine, but decided to try a private executive full-body scan. The results showed a small lung nodule. Doctors ordered more tests, including a biopsy which caused a lung collapse. The nodule turned out to be harmless, but his recovery took 2 months. That's why the American College of Radiology warns against full-body scans for people without symptoms. The better strategy: pay attention to your body. If you have unexplained weight loss, chronic cough, or persistent pain, get a targeted scan for that area, not the whole body. So, what did we learn today? 1. Bone density scans after 70 can lead to unnecessary medication. Focus on lifestyle and nutrition instead. 2. Brain MRIs for mild memory loss often cause anxiety, not clarity. Start with simple cognitive screening. 3. Cardiac stress tests can create false alarms. Choose safer, symptom-based evaluations. 4. Colonoscopy after 75 carries more risk than benefit. Consider home stool tests instead. 5. Full-body CT scans offer false peace of mind. Avoid them unless symptoms demand targeted imaging. Modern medicine can be life-saving, but not every test is your friend. The real secret to longevity isn't in the hospital, it's in your habits. Eat real food, move daily, stay connected, sleep deeply, and nurture your peace of mind. You can't stop aging, but you can absolutely slow it, and even strengthen your body and brain at any age. Now, I'd love to hear from you. Have you or someone you love ever faced unnecessary testing or procedures? What did you learn from it? Share your thoughts in the comments. Your story might help another senior make a wiser choice. And if this video helped you, please give it a thumbs up and subscribe for more science-backed, compassionate health advice for life after 60. Until next time, stay wise, stay curious, and take care of your beautiful, aging body.